Good morning students, here we come up with the arterial supply of the heart. So in the arterial supply of the heart, we discuss the right coronary artery. Now in the right coronary artery, we start first with two major points, and those 2 points will be right and left coronary arteries we are going to discuss. So in the first segment we are going to discuss right coronary artery. In the next segment, next lecture, we are going to discuss the left coronary artery. Both the coronary arteries, they are anatomically not end arteries. This is a very important sentence asked in 1 mark question answer. So anatomically they are not end arteries. Why anatomically they are not end arteries? Because the coronary arteries, right and left coronary arteries, they will anastomose with each other through their trunks, or they may anastomose with each other through their branches, or they may anastomose with each other through their sub-branches. Therefore, anatomically, coronary arteries are never end arteries, but functionally, they are end arteries. So here, we write down, functionally, they are called as end arteries. This is about the coronary arteries. And the second important point will be, this is the first point, this will be the second point. The second point will be, coronary arteries are also known as vasa vasorum. So they function as vasa vasorum of the heart. Because this vasa vasorum, as they take origin from as they are the main branches of the ascending part of the aorta. So therefore, the aorta, ascending part of the aorta, they will have vasa vasorum as coronary arteries. So these are the 2 points which you need to mention before describing right and left coronary arteries. Now we come to the right coronary artery. Now in the right coronary artery, please draw alongside with me. This, from here, we will start right auricle. Similarly, we will draw this border, right border. This is the groove for atrioventricular. This is the inferior border. And similarly, from here, we will draw the left auricle. So here we are going to write, this will be the right auricle, this will be the left auricle, inferior border of the heart. This is the atrioventricular groove. This will be the anterior part of interventricular groove. Now here, very important, we will draw at this level the ascending aorta. We are going to draw simply the cut section of ascending aorta. This is how we draw, and here what we are going to draw will be the cusp. We know that we are having 1 anterior and 2 posterior aortic cusp. So therefore, this is the anterior aortic cusp. Below that, we are going to draw, change of color, we are going to draw here the pulmonary trunk. So therefore, cross section of the pulmonary trunk. So I will write inside only pulmonary trunk. Very simple. And on this side, we are going to draw here cross section of superior vena cava. So this will be our superior vena cava. And on the extreme right side, we are going to draw in longitudinal axis sino-atrial node. So here we are going to draw this entire sino-atrial node. And we are going to mark this as SA node. Rough diagram, a very simple line diagram. Now we are going to start with the right coronary artery. We start with the origin of the right coronary artery. It will always take origin from anterior aortic sinus. So therefore, the name of this will be anterior aortic sinus, or in clinical usage, they refer to this anterior aortic sinus as the right coronary sinus. Please note down. These may be 1 mark question answers or MCQs. So anterior aortic sinus or right coronary sinus, the point of origin of the right coronary artery. And here we draw this artery, right coronary artery. Course. The entire course of right coronary artery will be, as it takes origin from anterior aortic sinus or right coronary sinus, it will pass in between two important structures, root of pulmonary trunk and right auricle. So in between the root of pulmonary trunk and right auricle, it will pass. And then, next important point, it will travel on the right side of the atrioventricular groove. So it will travel on the right side of the atrioventricular groove. Which portion of atrioventricular groove? On the anterior aspect of the heart. That is the right portion of atrioventricular groove. Next important point, it will travel till the inferior border of the heart. From the inferior border of the heart, it will curve posteriorly. Then it will go posteriorly. So now what we shall draw will be the posterior part. Posteriorly it will pass. Here I will draw with another color so that it may signify it will be light color. From here, inferior border, it will come posteriorly, and posteriorly it will travel in the posterior part of atrioventricular groove. So posteriorly it will curve and travel in the posterior part of the atrioventricular groove. Till the level of, it will travel till the level of the, if I draw this circle, till the level of the crux of the heart. Now here we should mention this structure. I will take this structure more on this side. We will mention this as crux of the heart, CRUX. This is also asked in MCQs or 1 mark question answer. What is crux of the heart? It is the meeting point of 3 grooves, and these 3 grooves are interatrial groove, sorry, second will be the posterior part of interventricular groove, and third will be the posterior part of atrioventricular groove. These 3 grooves on the posterior surface of the heart, they will join, and that point is known as crux of the heart. So therefore, once again I'll repeat, crux of the heart is the meeting point of the 3 grooves, interatrial groove, then posterior part of interventricular groove, and posterior part of atrioventricular groove. Here, this right coronary artery, it will pass till the crux of the heart, and just on the left hand side of the crux of the heart, just on the left hand side of the crux of the heart, it will anastomose, it will end. Just on the left hand side of the crux of the heart, it will end. How does it end? By anastomosing with. It will end by anastomosing with the circumflex branch of the left coronary artery. So therefore, in short, the left coronary artery which is coming will anastomose. with the right coronary artery slightly to the left of the crux of the heart. This is the entire course of right coronary artery. Now here, please pay attention. 60%, in 60% of the cases, right coronary artery will anastomose with the left coronary artery slightly to the left of the crux of the heart. In 10% of the cases, the right coronary artery will end at the inferior border itself. Another 10% of the cases, right coronary artery will end between the inferior border and the crux. Now remaining 20% is left. Remaining 20% of cases, the right coronary artery will traverse the entire posterior atrioventricular groove. I'll repeat, the last 20% of the cases, the right coronary artery will traverse across the entire posterior part of atrioventricular groove. This is how the right coronary artery will terminate. 60%, then 10%, then 10%, and then 20%. Course and distribution course is over. Now we come for the branches. So through the branches we'll understand the distribution of right coronary artery. Branches are very important. Course is over. Now in the branches, we'll study the diagram itself. In the branches, for understanding it in a simplistic manner, the entire course is divided into two segments. The first segment will be from the origin till the inferior border, and the second segment will be from the inferior border till the crux of the heart. That means posteriorly. So second segment is related posterior to the heart. That is from inferior border till the crux of the heart. Now branches of the first segment, please note down. In the branches of the first segment, we divide these branches into ventricular rami and atrial rami. So they are known as, I'll keep on writing on one side and I will draw on one side. For example, if I write here from the first segment, ventricular rami. What are the branches of the ventricular rami of the first segment? They are, I will write here, right anterior ventricular rami. These are the name of branches, right anterior ventricular rami. Now this right anterior ventricular rami, if I draw over here, that means they will arise exactly at right angle to the right coronary artery. These are the right anterior ventricular rami. And they will supply sternocostal surface of the right ventricle. So they are called right anterior ventricular rami. Out of this right anterior ventricular rami, one of the branches is longest, and that branch I will name it as the right marginal artery. Now this right marginal artery, if I draw over here, it will pass along the inferior border of the heart. This is the right marginal artery. So it will pass along the inferior border of the heart and it will supply the right ventricle, right marginal artery. So this is the branch of the right ventricular, one of the longest branch of the right anterior ventricular rami. Third branch of the ventricular rami. Now third branch of ventricular rami, a beautiful branch. Now here, this branch is the first branch of right coronary artery. This branch is also known as the first branch of right coronary artery, and name is right conus artery. So here I will mark this as right conus artery. This is coming, no?
Yes.
Okay. So right conus artery is the first branch of the right coronary artery. It will supply the infundibular part of the pulmonary trunk. Now this right conus artery, sometimes it will take origin directly from the anterior aortic sinus. If the right conus artery takes origin directly from the anterior aortic sinus, then in those cases it is called, this artery will be known as third coronary artery. Please note down, Viva question, 1 mark question answer MCQ. What is third coronary artery? Third coronary artery are those cases where the right conus artery will directly take origin from the anterior aortic sinus. In those cases it is called the third coronary artery. And now another interesting fact, this right conus artery will anastomose with, sometimes it will anastomose with the left conus artery, which is coming from the left coronary artery in front of infundibulum of the pulmonary trunk. This anastomosis, which is produced by the right conus and the left conus arteries, it will be known as the annulus of Vuissens. Please note down, this is often asked in 1 mark question answer. Here I am going to write down annulus of Vuissens. What is annulus of Vuissens? V-I-E-U-S-S-E-N-S. So this is annulus of Vuissens, right conus and left conus in front of the infundibulum of pulmonary trunk. So here we finish the 3 major branches of the ventricular rami. Which segment of right coronary artery? First segment of right coronary artery. Now here I will just keep on writing down. On this side I will write down atrial rami. Atrial rami. We have finished the ventricular rami. Now we are starting with the atrial rami. From the first segment itself, very easy. Coming back to this diagram, ventricular rami we have finished on this side. Now atrial rami, please show the atrial rami like this. These are the atrial rami. They will supply the myocardium of the right atrium, and they are arising just like ventricular rami at right angles. So these are called right anterior atrial rami, right anterior or right lateral atrial rami. In these atrial rami, one of the most important branches which I am going to first mention here, out of these atrial rami which I have drawn, the most important branch will be the sinoatrial nodal artery. Please write down sinoatrial nodal artery. So therefore, the sinoatrial nodal artery which we are going to draw, it will take origin from right coronary artery. This is very important. In between which 2 points? In between the root of the aorta and right auricle. So in between the root of aorta and right auricle, this sinoatrial nodal artery will take origin. And then after taking origin, it will travel in front of superior vena cava. It will cross the superior vena cava laterally in front of it, and then it will pass through the longitudinal axis of SA node and supply SA node. So therefore, this artery which we have drawn, we are going to name this as sinoatrial nodal artery, which is a atrial branch of right coronary artery. So here we finish the branches on first segment. Now the branches present on the second segment. So I will use another color for explaining these branches. In the second segment, the branches are once again divided into, I will write here, the branches are divided into 3 major branches. The first will be the right posterior ventricular rami. So please note down the right posterior ventricular rami. This is the first branch. And these right posterior ventricular rami, they will supply diaphragmatic surface of the right ventricle. That also you need to mention. So the right posterior ventricular rami will supply diaphragmatic surface of the right ventricle. This is the first branch from second segment of right coronary artery. Do not complicate, very simple. So right coronary artery second segment, once again I will repeat, it starts from inferior border till the crux of the heart. First branch, right posterior ventricular rami, supplying the diaphragmatic surface of the right ventricle, simple. No need to draw. Second branch, I will mention here the second branch. The second branch will be right posterior atrial rami. Very simple to understand, very simple to remember, right posterior atrial rami. This will be the second branch. This right posterior atrial rami will supply, now here this is important, the right posterior atrial rami will supply the posterior surfaces of both the atria, right and left atria. So the right posterior atrial rami supplies the posterior surface of right and left atria. Please note down, over. Now comes the main branch which we have to draw. Main branch will be, I'll write on this side, third. Basically it is the main branch, posterior interventricular artery. The posterior interventricular artery, or it is called posterior interventricular branch. Now here, this posterior interventricular branch will take origin from the second segment of the right coronary artery, and it will travel, here I am going to draw, it will travel in the posterior interventricular groove. So this posterior interventricular branch or posterior interventricular artery will travel in the posterior interventricular groove, where it will anastomose with the anterior interventricular artery, which is a branch of left coronary artery. So here it will anastomose. Now, this posterior interventricular artery, this is very important, it will supply the posterior inferior 1/3 of ventricular septum. This we need to mention. So it will supply the posterior inferior part of 1/3 of ventricular septum. This is very, very important. What does it do? It will supply the posterior inferior 1/3 of ventricular septum through its septal branches. So here we show, from this we show various septal branches. At the same time, this posterior interventricular artery will also supply the diaphragmatic surfaces of the right and left ventricles both. So they will also supply the diaphragmatic surface of right as well as left ventricles. Please note down, it will also supply diaphragmatic surface of the right and left ventricles. These are the supply of the posterior interventricular artery. Try and understand. What is posterior interventricular artery supply? The posterior interventricular artery will supply the posterior inferior 1/3 of ventricular septum, and it will supply the diaphragmatic surfaces of right and left ventricle both. And now comes the third branch of posterior interventricular artery, which is very, very important. And that branch will be these septal branches of the posterior interventricular, through which it will supply the posterior inferior 1/3 of ventricular septum as well as diaphragmatic surface of the right and left ventricles. Out of that, one of the septal branch will have a recurrent course. It will form a loop. It will form a loop and will have a recurrent course. It will form a loop and have a recurrent course. This is known as the atrioventricular nodal branch. So it will supply, if I draw on this side over here, this will be atrioventricular node, and therefore I'm going to write this as atrioventricular node, and I'm going to mark this as the atrioventricular nodal branch. So this is the branch of posterior interventricular artery, one of the septal branch of posterior interventricular artery, which is called atrioventricular nodal branch. Now here, we come back to this branch, sinoatrial nodal branch. It is often asked in MCQs, 65% of human beings, 65% of cases, in 65% of cases, the sinoatrial nodal branch is a branch of right coronary artery. And in 35% of the cases, 35% of cases, this sinoatrial nodal branch is a branch of left coronary artery. Please note it down. This is a very important variation. So only in 65% of cases, the sinoatrial nodal branch is a branch of right coronary artery. In the remaining 35% of cases, this sinoatrial nodal branch is a branch of left coronary artery. This is one very important variation. It can be in applied anatomy also. You can mention this as a part of applied anatomy. And now the most important portion, which is present in applied anatomy. The posterior interventricular branch, sometimes, in rare cases, it will be a branch of left coronary artery. In those cases where the posterior interventricular, if it is a branch of left coronary artery or if it is a continuation of left coronary artery, then those cases are called left coronary predominant cases, or left coronary dominance, or left coronary dominant heart. Whereas in normal cases where the posterior interventricular artery is a branch of right coronary artery, then it is called right coronary predominance, or right coronary dominance, or right coronary dominant heart. So depending upon the origin of posterior interventricular artery, whether it is a taking origin or whether it is a branch of right coronary or whether it is a branch of left coronary, based upon these two, based upon this posterior interventricular artery, whether it is a branch of right coronary or left coronary, the entire heart can be known as right coronary dominant or left coronary dominant. This is asked in MCQ. Which is the name the artery which is known as right coronary or left coronary dominant, and that is posterior interventricular. Depending upon the branching pattern or depending upon the origin of posterior interventricular artery, the entire heart is known as either the right coronary dominant or left coronary dominant heart. So these are the two applied anatomical points of the right coronary artery. Please note it down. First was the sinoatrial node, 65%, 35%. Second is the branching origin of posterior interventricular artery, known as right coronary or left coronary dominant. So here we finish the entire right coronary artery. Thank you very much.